The introduction does a good job of explaining the importance and relevance of neutrophils while studying gestational diabetes mellitus, henceforth known as GDM. Previous research had found that pregnancies associated with GDM also had an increased risk of preeclampsia. Preeclampsia has been associated with the activation of neutrophils and therefore neutrophil extracellular traps, henceforth known as NET. NET can undergo NETosis and release neutrophil elastase into the extracellular environment and can contribute to the characteristics of GDM.
BWO human placental cells were grown under low and high glucose conditions, and neutrophils were directly added to the BWO cells depending on the condition. In Western blotting, rabbit and mouse primary antibodies were used to probe for IRS1, GLUT4, and beta-actin, with corresponding HRP secondary antibodies. The method section regarding Western blotting was not reproducible, as it was not detailed enough, and did not state blocking reagents, incubation times, and concentrations, and whether manufacturers' protocols were followed. For the results figure, the graph in the Western blot was neatly organized and formatted for it to stand alone.
GLUT4 and IRS1 expression levels were the lowest in the absence of insulin with the presence of NE. However, they were the highest when the trophoblast cells were incubated in insulin, but in the absence of NE. The control condition displayed the second highest levels of both GLUT4 and IRS1, followed by the condition where trophoblast cells were incubated in both insulin and NE.
The authors discussed that GDM is associated with overt neutrophil activity, which can lead to net formation and netosis and ultimately can release neutrophil elastase into the extracellular environment. It was also mentioned that previous studies have shown that the presence of exogenous NE could promote tumor cell growth by a mechanism involving NE. The exogenous NE gets absorbed by cancer cells, where it fuels enzymatic activity, leading to the degradation of IRS1, which is a key regulatory molecule for cell proliferation. We agree with this discussion point because the figure shows that IRS1 molecule expression was the lowest when the trophoblast cells were incubated in NE. Furthermore, the discussion mentioned that exogenous NE led to insulin resistance. We also agree with this discussion point because the figure shows that incubation in exogenous NE led to a decrease in the abundance of GLUT4 proteins, which is directly associated with a decrease in glucose uptake, and this was regardless if the trophoblast cells were incubated in insulin or not. Overall, the study shows that GDM is associated with overt neutrophil activity, resulting in placental infiltration, net formation, and NE release. The implications of this study lays a foundation for more potential screening and intervention tools to detect GDM, as current detection methods lack standardization and are not the most effective.